Hey, Dr. Robinson here, longevity medicine expert and host of the Longevity Protocol podcast. In a really brief 5 minutes, I'm going to explain how stem cell IV therapy can help to reverse aging and improve health. Everything here is for educational purposes only and does not constitute medical advice or treatment. There are 5 different types of stem cells, but we're going to focus on mesenchymal stem cells, which then have the ability to transform and support fat, cartilage, bone, muscle, and connective tissue cells, really specific type. Where do MSCs come from? Well, they're processed from ethically donated human birth tissue from healthy consenting mothers in the United States who passed a medical background check, blood screenings, had a full-term live C-section birth. The stem cells are then procured from the spongy part of the umbilical cord where the immune system properly recognizes these stem cells. Now, MSCs are medicinal signaling cells. That's what's important to know. They secrete growth factors and they provide inflammatory control. They deliver repair messages. They decrease something called inflammaging. They provide mitochondrial energy production. They restore youthful cell functions and telomere lengthening. And the most important thing they do is help with zombie cell or senescent cell clearance. Now, these zombie cells are created through cellular damage, stress, and poor nutrition, even hormonal imbalances and other things. All of this leads to zombie cells leading to disease cells and even cancer. They're kind of communicating that way. And then one of the most exciting things is how stem cells work with exosomes, which are small little cellular messages, all working to improve cellular function and cross communication. And these are added to the IV, creating a synergistic effect. Now, MSCs have been studied extensively on helping with improving cardiovascular function, treating heart attack and stroke, improving brain function, helping with dementia, Alzheimer's, improving skin health like elastin, collagen, all helping with muscle, which helps muscle to respond and bone to grow. It reverses osteoporosis, enhancing the immune system and helping with autoimmune conditions and directly treating the aging male and the aging female. Now, part of why we know MSCs help to reverse aging is their effect on lengthening telomeres. Telomeres are the little end caps on top of your chromosomes, and we can measure this directly in the body, and this is direct age reversal. Now, stem cell IVs have some potential hurdles, and they've got to be overcome in the clinical setting, and by preparing the patient's body, ensuring the IV itself is primed, and the optimal source of the MSCs and dosing is in place, then we can get better outcomes. Now, patient priming involves hormone therapy, the anti-aging medication called rapamycin, nitric oxide, vitamin D, certain peptides, and something called remote ischemic preconditioning using a blood pressure cuff. And the body will actually utilize the stem cells then in an efficient and effective way when we do all of these things. Most protocols out there do not do these extra steps, and it provides inevitably inferior results. Now, the IV itself has to be primed, and there needs to be a correct mix in order for that to improve survivability and functionality of the stem cells. And the stem cells literally need the proper food environment to bring the best results. And then ultimately, most importantly, the optimal dose needs to be provided to ensure the stem cells are actually used. So either too high or too low is going to perform not the way you want it. There is a scientific validation for this optimal MSC dose at 5 million cells, along with about 100 billion exosomes. And then the best approach, of course, for all of this in medicine is a comprehensive approach for the patient. It's what we always do. And stem cells have a natural comprehensive effect already on the body, helping to reverse the ravages of aging. If you're interested in becoming a new patient, please contact our office. We'll see you soon. Thanks.